My job this morning is simply to reinforce what has already been ably conducted through the presentations of the Chief Medical Officer, Dr. Hazel Laws, as well as our Chairman for the Disaster Mitigation Council of NEMA, the Honorable Attorney General, supported by the National Disaster Coordinator, Mr. Abdias Samuel. However, as the Permanent Secretary would have indicated when she gave the outline of today's press conference, she would have indicated to you that the thrust of my input would focus on the recent meetings of the CARICOM, specifically the COSAD meeting. COSAD stands for the Council on Social and Human Development, which is part of the quasi-cabinet structure of CARICOM, for which our Honorable Prime Minister is the lead head. And the current chair of COSAD is the Minister of Health for Antigua and Barbuda, the Honorable Malwin Joseph. It is a rotational chairmanship, because I do recall when I would have taken office in 2015, I don't know, maybe for my sins, at the same time I had to be chair of COSAD, chair of PANCAP, chair of CAFA. So it is rotational indeed, so now it has come to the turn of Antigua and Barbuda, so I'm glad it's him now and not me. Anyhow, nevertheless, we support each other. The other part of the presentation is to focus on yesterday's heads of government meeting that would have been convened in less than 48 hours. That meeting was put together, and it was a tremendous effort, and what was able to be achieved last evening was nothing short of phenomenal, considering you're coming from 13 different jurisdictions in which there is still a sub-region called the OECS, whose own considerations, sovereignty, and nuances as it relates to travel would have to be taken into account as we try to come up with logical way forward to address the spread of the virus, to contain what is happening, and to minimize any fallout, in particular our fallout to tourism. And as I say that, at a point during my presentation, I will be calling forward the Honorable Minister of Tourism, Honorable Lindsey Grant, to join me at the podium to share his own take on yesterday's heads of government meeting, at which some of these issues would have been discussed. But if I can start first with last Wednesday's meeting of COSAD, which is the Council on Health and Social Development, as I indicated earlier, the Chief Medical Officer and I would have sat in on that meeting for several hours again, and as we would have done several weeks prior, we promise you that these meetings are going to be coming fast and furious as we get further and further into the crux of this outbreak, because we have not seen anything yet. But at the same time, as Mr. Samuel said, we would want to contain and to limit and to mitigate wherever possible. Last week's meeting of COSAD was a takeoff from a prior meeting that I would have reported on. I think it was the afternoon of February 3rd when we held the first interministerial press conference right in this very room. And at that first meeting, the Cruise Line Industry Association, CLIA, as well as the FCCA, the Florida Caribbean Cruise Association, would have been accorded space on the COSAD agenda to address some of their own concerns as it relates to the cruise industry. Now, for all of us in this room, I shouldn't have to tell you how important the cruise industry is to the revenue base and to the economic structure of St. Kitts and Nevis. The evidence is clear based on our recent investment and opening of a second cruise pier, how much weight is being placed on tourism, especially as it relates to cruise tourism, given the fact that St. Kitts and Nevis now has the distinction of being considered a marquee port, meaning that we would have arrived at the threshold of welcoming at least 1 million visitors, a status quo that we have been able to maintain for the last 24 months and for which we are proud. Now, in that initial meeting, the cruise industry would have outlined, the meeting on the 3rd, would have outlined the normal procedures that they would have in place, because outbreaks on ships in terms of infectious conditions like gastroenteritis, etc., these are nothing new. Now and again, you might also hear one or two persons might be on board with something as milder as the chicken pox, although it is contagious. And as a result of that, To put it in local parlance, this is not the first rodeo when it comes to the Cruise Industry Association, specifically the FCCA. Nevertheless, even though this present COVID-19 virus is part of a wider family of coronaviruses, the manifestation, the biology behind it, the epidemiology behind it is much, much different. The amount of persons who are dying from this far outstrip the figures that we would have seen in 2002 and 2003 as related to the SARS epidemic, which also was corona-based, but was focusing on the Southeast Asia area, hence the name SARS. Of course, similar outbreaks would have taken in the Middle East, and that gave rise to MERS and so forth. So on its own, coronavirus is nothing new, as we would have said at the last press conference. Our medical chief of staff, Dr. Wilkinson, made that very clear in the press conference on the 3rd of February. However, that initial meeting that we had on the 3rd of February would have then spawned the outcomes of the other meeting that was held on the 26th last Wednesday. And coming out of that meeting, a working group was put together, made up of CARPHA, the Caribbean Public Health Agency, and I should indicate at this juncture that CARPHA, which is based in Trinidad, is CARICOM's version of the CDC, the Centers for Disease Control in the U.S., headquartered in Atlanta, Georgia. So for the purposes of CARICOM, we deal specifically with CARPHA, even though there is some amount of collaboration with other global health authorities, including but not limited to the Centers for Disease Control. The European Union also has its own grouping that does similar work on behalf of the 27 member states of the EU. What we would have done in that same meeting from that working group that also comprised, as I said, PAHO out of its office in Washington, D.C. And by the way, PAHO also has a sub-regional office in Trinidad and Tobago, thereby facilitating easier access when it comes to capacity building and technical assistance to the member states of the region. It would have also included the the Minister of Health for Jamaica, the Honorable Christopher Tufton, and also the Minister of Health for Grenada, who also happens to be one of 2 directors of the World Health Organization representing the Caribbean Basin, and that individual is the Honorable Nicholas Steele. Coming out of that meeting on Wednesday, it then formed the basis of developing a working document which is intended to be a common position on travel-related policies and guidelines and minimum standards that all of CARICOM should be on the same page with. That working group produced a document by Friday. That document then formed the basis of the discussion that was held for the most part yesterday. That meeting yesterday, and I should say at this juncture that all of these activities at the CARICOM level are being ably chaired by the current chairman of CARICOM, the Honorable Mia Mottley, Prime Minister of Barbados. And at this point, I would like to express on behalf of the government of St. Kitts and Nevis that we are indeed grateful and privileged to have the leadership of Mia Mottley as chairman of CARICOM right now. Don't want to say it's woman power, but that helps. But she has done a tremendous job under extreme pressure and continues to show remarkable leadership and direction, and that is something that should be commended. Yesterday's conduct of the heads of government meeting was a case in point. It was a difficult meeting to manage because, as I indicated, you're made up of 13 member states, and then if you take into account the CARIFORUM members who are not necessarily present but with whom we have a relationship, those being Cuba as well as also the Dominican Republic. Haiti was present, but Haiti is a CARICOM member, and nevertheless it was difficult to achieve consensus. That meeting should have started around midday yesterday, up until the chief medical officer and I logged off. Well after 6 o'clock, we were in there for about 6 hours. And then by the time most of you may have seen the press conference, that was like another 2 hours in coming after that. So it tells you the intensity of what we are dealing with. At that meeting, we had the privilege of in-person representation from the Florida Caribbean Cruise Lines, the FCCA, led by their president, Ms. Michelle Page. It also included representation from the Carnival Corporation to represent Carnival Cruise Lines. Norwegian was also represented, and also MSC Cruises were represented. And I think Royal Caribbean may have been online. Minister Grant, you could correct me on that score, that they were online. Now, because of the short notice in terms of convening yesterday's meeting of the heads, it was not possible for every single member state to be represented there in full. But given the fact that we would have invested heavily in technology, a number, I would say the majority of persons who participated in that meeting, outside of members of the local media for Barbados and the social partnership construct of Barbados, would have been participating online. The St. Kitts delegation in that meeting yesterday would have been led by the Deputy Prime Minister, the Honorable Sean Richards. It also included representation from the Honorable Attorney General and Chair of the Disaster Mitigation Council, the Minister of Tourism, the Honorable Lindsay Grant. It included the Chief Medical Officer and also me. Now, that meeting, if I am to put it in context, was done for 3 reasons. One, to outline the roles and responsibilities of the government, state agencies in particular, national emergency management agencies through their regional head and also individually. Of course, their regional group in Sidima was represented at that meeting, as well as impacts. And I think the JRCC would have been present in the room at that time. That is the Joint Regional Command Center that works with our immigration departments around the region in terms of advanced passenger screenings, the APIS system that is being used, so that persons of interest could be flagged even before they arrive at your port of call. And while I'm on that score, I should note that the JRCC is now being questioned to widen its mandate in terms of offering similar type of pre-screening and pre-information to the local authorities in the member states when it comes to cruise passengers. So, Ms. Hughes, look out to get a call from them as it relates to perhaps contact that would be made through the FCCA or the Cruise Line Industry Association. Another goal of yesterday's meeting was to ensure that there are clear communication lines as we build out the response mechanism to the crisis. Abdia Samuel would have gone to great detail to indicate what some of those mechanisms are. Because in a climate of fear and misinformation and the proliferation of all kinds of messages on WhatsApp being forwarded to people, anything from Lysol spray curing coronavirus to anti-malaria tablets being the fix for it, to garlic-infused drinks to help cure it, none of which are correct, by the way. A lot of things are out there. But equally, social media has its place, and I have also seen some very positive messages that are being put out there, short videos, cartoon versions, animated type information that could get the material and the information down to Joe Blow, the lowest common denominator when you're talking about reaching people at the level that they're at. None of us in here is a college professor who figures that you have the need to speak up here in jargon and cant, and the rest of us are down here who it matters to, but we can't get the information. So whatever means that we can use to get the information out, I will be the first person to say let's use it. But please, for God's sake, if you're getting information that seems wrong, seems off the wall, do not forward it to your contact list. We prefer that you call the authorities, whether it is NEMA, as some of you have been doing before, or the Ministry of Health. Ask a question. We will not be offended if you ask a question, because knowledge is power. But at the same time, a little knowledge is a dangerous thing. Very, very dangerous thing. The other area that we would have looked at yesterday at the heads meeting would have been the issue of ensuring that as we build out what might be a common position that outlines basic guidelines for handling travel to the region, at the same time we recognize and we respect the fact that every member state of the region has the right to its sovereignty. In other words, no FCCA and no Cruise Industry Association is going to dictate to Jamaica or to Trinidad or to St. Kitts and Nevis what these countries should be doing to protect its citizens. But at the basic level, we expect that we should all be on the same page with what we consider to be minimum guidelines. Now, why do I say this? Last week, there was an incident involving a cruise line in Jamaica that was the subject of a lot of confusion, where docking and pratique would not have been given. Pratique, for those of you who are not familiar with the term, it's a maritime term which is meant to explain that once a ship is ready to come into port and you send your advance information, which should reach us no later than 12 hours, am I right, Mr. Riley? 20 at best, right, that you send a medical maritime certificate that says the state of play on board your vessel. If we have reason to believe it is going to be a problem, then the state, through the port health workers, advice from the chief medical officer, medical board if necessary, and so forth, and the environmental health officers, we reserve the right to accept or deny docking and disembarking. So that is what is meant by pratique. So we recognize the fact that in the case I started earlier as an example in Jamaica's case, Jamaica had some amount of confusion in terms of information being channeled. Again, to the point I'm raising, that communication channels must be clear. But at the same time, once rumors started flying around that persons who were COVID-19 positive were on board, of course no government in their right mind is going to tell you, all of you get off, come in, take advantage of the lay of the land, and run wild off the reservation. That can't happen, okay? In the meantime, when you talk about nuances in member states, let us not forget Jamaica is one of those territories that is going through a dengue outbreak. So they now have a double whammy that they're facing. So in light of all of that they have in front of them, and not being a necessarily rich country, because everybody knows if there are two countries in the Caribbean that are going through an IMF program right now in terms of debt restructuring, it's Jamaica and Barbados. So all of these considerations go into play when you think about nuances that operate member state to member state. So there is where differences come in. But I say all of this to say that at the end of the day, in as much as we want to make sure we cooperate and that we are on the same page, our primary responsibilities as ministries of health and national security and also governments is to make sure you protect the lives of your people. First and foremost, yes, you want your economy to remain buoyant. Yes, you want to feel that your tourism industry could be insulated as much as possible. But in the best of times, the tourism industry is a very fragile creature. It's a delicate balancing act that you're playing in terms of satisfying the needs and the wishes and the ambitions of your country, who has invested in infrastructure to satisfy the gains that could come from that industry. And at the same time, you have the cruise industry, on the other hand, who might put in a request for a mega ship, and it might take 5, 6, 7 years to build and millions of dollars to fork out. And you hope at the end of the day, once you put that baby in the water, that it continues to ply the oceans of this world, taking people on adventures and experiences, because that's what you're selling. You're selling an experience to them, something different from what they're accustomed to. That at the same time, you make sure that they themselves follow their own standards when it comes to health practices, the safety of the people on board, and also the safety of persons on board who may get sick, because all of these ships are supposed to be outfitted, regrettably, but I have to say it, with a morgue in case you die on board. Also with a quarantine area, they have a clinic on board at the same time. But depending on the nature of an illness or an outbreak on one of these vessels, they may not be able to contain it and would wish that at the next port of call, they can put off the sick person. We go through that all the time. There are numbers of persons who come here because a cruise is a relatively less cheaper option than a stay-over visit through a hotel. And it might be on their bucket list that these are 10 things I would like to do before I die, and one of them is to see the Caribbean. And of course, they're supposed to have medical checks, but everybody is not always honest. And some of them may not tell you when they book their cruise that you want to sell the cabin space for, that I have a multiplicity of health issues. I may have arrhythmia. I may have a lung condition. I may be on a list waiting for a kidney and I might need dialysis. And they show up at your jurisdiction in poor health, and you have no choice but to take them because you put out your shingle and you told the rest of the world, I am open for business as a port of call for cruises. The problem becomes even more compound when it comes to you being a home port, as in the case of Puerto Rico, as in the case of Barbados. If I'm not mistaken, Barbados is a home port for European brands such as the Bremer. So, and they have to provide even more than we would have to provide, because it then means that people fly into the jurisdiction to start the cruise there and would fly out of the jurisdiction when the cruise ends there. And in a number of cases, for example, Barbados, where they have citizens living in the diaspora just like us, a lot of Barbadians who live elsewhere will fly down to Barbados to start their cruise, connect with families and friends that they hadn't seen, tour the Caribbean, come back into Barbados, and then what happens if there's an outbreak on the ship? Is Mia Motley going to tell the Barbadians on board in her diaspora, look, you're sick with COVID-19, get on the ship and go home? That's their home. Then you have a constitutional challenge that you're looking down the barrel of, because they have the right to be there. So their responsibilities are even more onerous than us, who just offer them a port of call and a listing on the number of stops that they sell for a cruise. Okay, now the risk reduction is something else that we looked at yesterday. And what we would have come up with was a 7-page document that outlines inter alia the various provisions that we would have in place in terms of how we treat with what we consider to be an infection, the pre-screening mechanisms that the cruise industry would have to guarantee us would be in place before you allow somebody to board the vessel. We are also discussing with them when persons get ill on board and have symptoms that might seem to be along the lines of the coronavirus, what mechanisms are you putting in place on board? If that person has to disembark, what are the mechanisms for getting them off the ship? Because obviously what happened with the Diamond Princess in Japan, you don't want to happen in the region. Because essentially because the infected persons were not removed, that ship became a compact incubator that resulted in the maritime disaster that they are now trying to clean up and do damage control and destination image rebuilding for in Japan and elsewhere. So these are some of the things we want to mitigate against. Other areas that we are looking at in terms of inputs, how do you define a suspected case? We have guidelines from the World Health Organization that we are following as it relates to that. These guidelines would have been issued and reissued up to yesterday to everybody who was in place. And of course, these are guided by the international health regulations that the World Health Organization would have issued in 2005 and then would have done revisions for up to 2019. For those of you in the media, feel free to check the WHO website for that information. International health regulations dated 2005 with the updates that were done as recently as 2019. You will find the information there. The document also outlines what enforcement measures at a minimum the cruise industry would commit their members would commit themselves to, the advice that should be coming from countries relative to those restrictions that would have been issued as it relates to countries of interest. For example, St. Kitts and Nevis would have issued 2 advisories, one on the 1st of February, and then we would have refined it and reissued it on the 20th of February. The first one we issued on the 1st of February would have been the travel restrictions as it related to persons wanting to go to China, in particular Wuhan, which is the global epicenter, and persons wanting to leave that hotspot, where we would have advised, if you're in those areas, remain there. If you were planning to go there, put off your trip. Because in the event that you show up here at RLB or at the Vance Amri Airport in Nevis, it's not a matter of if you think you will be pulled over. It's a matter that, yes, you will be pulled over. And you will be questioned, and you will be treated accordingly by the immigration and health authorities based on how you answer questions, based on the perusing of your travel documents, to see where you would have been in the last 6 weeks. And that is why, in a previous press conference, Head of Immigration, Marceline Hughes, as well as the Chief Medical Officer, would have indicated that question 17 of the landing card must be answered. It is not optional. You have to answer it to say where you would have been in the prior 6 weeks. Also, we would have widened the number of countries of interest that we have. The CMO listed those countries for you. If you would want us to reissue those, we can tell you what those are again. But they include Singapore, Italy, Iran, Vietnam, Hong Kong, and so forth. Countries where we would have seen considerable numbers in the death rate as well as in the exponential rate of spread. So these are countries that we're looking out for. And the CMO would have told you, as it related to the home quarantine or the hotel-based quarantine, that would have been taken as an option in the case of about 4 or 5 of those visitors. Well, 1 or 2 of them were our citizens, if I recall correctly. So these are some of the issues that we are looking at. We are also looking at the mechanisms that will be in place. For example, once you have a suspected COVID case on board and you don't want to repeat what happened on the Diamond Princess, for example, how do you extract that person off the ship? Is it a situation where we are going to then commission the use of a helipad to get that person airlifted off the ship so that you minimize the risk by getting them in our local ambulance to take them up to JNF to then await an air ambulance to get you out of here? These are some of the considerations that we are working on right now in collaboration with CARFA, IMPACTS, and SEDEMA at the same time. Now, one of the deliverables, or rather two, that each member state has to turn into CARICOM by the end of the day tomorrow via CARFA is a recapping or reconfirmation of those countries that would have been listed in travel advisories. Those of you who listened to the press conference last night with Mia Motley would have been told that at least 8 Caribbean jurisdictions would have issued travel advisories, and of course St. Kitts and Nevis, as I listed earlier, would be among that number. And also the rationale behind the advisories, we have to turn that in as well. And then at the same time, we are also being asked to indicate, for the benefit of CARICOM, basically how we feel that the best mechanism should be in place as it relates to removing someone from the ship so that we protect our own people. As I listed, just because we are trying to arrive at a common position, it doesn't mean that what the bigger states want, like Jamaica, Guyana, and so forth, will be it. We respect the sovereignty of each member state, the nuances that are on the ground, and the priority of the home government in terms of job one, being able to protect your citizens in terms of their health and their safety, and at the same time, by extension, the protection of our borders. Now, we recognize as we build out this mechanism that the member states of CARICOM are not rich countries. These are countries, all of them, that have limited resources. St. Kitts and Nevis happens to be the smallest independent member state of CARICOM and also the smallest independent member state of the Western Hemisphere. Nevertheless, we do not get a pass or an excuse for smallness in terms of the minimum standards that we are called upon to ensure that we have in place. So as a result of that, we have to do everything in our power. We have to continue doing what we are doing and do even more. I should also state at this juncture that we are already at the point where we have determined that based on the projections that the PAHO would have said to us relative to the percentages of persons who are likely to become infected, those likely to die based on the experiences in Wuhan, etc., that a decision has been taken by the Ministry of Health that all 3 of the hospitals in St. Kitts and Nevis would have to help carry the load in terms of the treatment of persons. Okay? St. Kitts and Nevis is smaller. Mary Charles only has 10 beds. Pogson has 12 beds. Jane France General Hospital has anywhere between 164. If you include some of the sick bay areas, and Alexandra has 50. Okay? Our population, depending on which data set you look at, put us somewhere between 48,000 to 52,000. Of course, making room for migration patterns that may not have been picked up since the last census that was done in 2011. So this is what we're facing. In terms of quarantine spaces, there are several options that we are working on. A number of these options may involve refurbishment of buildings that are not currently in use. And while I'm here, let me use the opportunity to explain the difference between quarantine and isolation. The Chief Medical Officer would have done that in the first press conference. I don't remember if you did it again this morning. Could you come up and explain that to them again, that the difference between the two?
Okay. Isolation speaks to the separation of ill persons from other individuals such that the ill person does not transmit the virus to well persons. So that's isolation. Quarantine is a process by which you restrict the movement of individuals who are well and asymptomatic, but they may have had exposure or they may have been exposed to the virus. And so you have to quarantine them and wait and see if they do develop symptoms. So that's quarantine versus isolation. All right, so if we have an ill person and they have the COVID virus and we are managing them, they will have to go to one of the treatment centers. As Minister just said, if the virus comes here, all our hospitals will eventually be treatment sites. So persons will be isolated at the hospital, managed and treated. Quarantine. So if you come into St. Kitts right now with a travel history to Italy, all right, to one of the cities that is locked down in Italy, we are going to have to quarantine you because of you are being you would have been exposed to the virus. So we have to restrict your movement and observe for the development of symptoms. And some individuals, she consented to being tested. She came in from Italy. She consented to be, to be tested.
What I should also indicate, to add to what the CMO has said, that the 2 individuals who have been tested, for the benefit and the comfort of all, their test results were negative. Okay? May I repeat that, to the best of our knowledge, between the Ministry of Health and the sister agencies in NEMA, Immigration and Customs, we are not knowledgeable of any single case of anybody in St. Kitts and Nevis who has tested positive for COVID-19. We have seen a lot of nonsense being put out in social media, especially being propagated all over WhatsApp and so forth. I don't know where those persons are getting their information from, the objective they're trying to achieve by instilling fear and perhaps hysteria, which helps nobody in this situation, because Dr. Wilkinson is right here. Some of us are more likely to die from sheer fear of this thing than to die from COVID-19. Okay? So please, for the benefit of your own sanity and your own mental health, rely on official sources of information for your data. The CMO would have indicated to you that while we are building capacity at Jane France Hospital, now that we have the gene type machine in place and the training is about to begin, there is a private sector laboratory in St. Kitts and Nevis that has, for the last week at least, been able to test for coronavirus, and that is the laboratory that we would have used. Okay? That laboratory happens to be perhaps the most cutting-edge laboratory in the CARICOM region, outside of the level 3 Rolls-Royce type laboratory you will find at CARFA and in the French West Indies. Okay? So that is what we have available at this time. Now, before I invite the Minister Grant to give his take on the inputs and the presence of the Cruise Line Association and the FCCA in yesterday's meeting and what it means for cruise tourism in St. Kitts and Nevis, I would like to end on a note that I would have mentioned at the last press conference on February 3rd, and that is to say that as we continue to respond to this crisis, which is going to hit us, it's not a matter of if, it's a matter of when. We see how close St. Martin is to us and the cases we have there, the open borders between French and Dutch St. Martin, and the fact that, by the way, because French and Dutch St. Martin are protectorates of France and the Dutch governments, when flights come from those jurisdictions, they are considered domestic flights, which means that no screening is going on. You're treated as if you're just going from, let's say, maybe New York to New Jersey, if it was the United States. So we have to be extra vigilant when it comes to dealing with persons who originate out of ports, whether it's Schiphol coming through the Amsterdam area, or Charles de Gaulle out of France, because they find their way into St. Martin. So we have to, or maybe the ABC Islands down south, and then St. Martin. So we have to be careful with that. But at the same time, this does not give us the right, as we had seen in the last couple of weeks, to be practicing xenophobia against people of Asian origin. The epidemiology of this thing is now showing us it's all over the world. It may have started in China, but it is all over the world. Integration among races has happened so much that you and I can't, within a certainty of our life, with a bullet to our head, tell you if this person across there has Italian in them or they came from Italy. You have to rely on the information that is in front of you when it comes to the travel documents of the individuals. And if it happened in St. Martin, who just finished having carnival, where some of our own citizens went down there for it. Do you want me to finish the sentence? Okay. So I thank you very much. I ask again that we try to remain calm, do all that you can individually and collectively. I should also indicate to you and at the same time commend some of the religious organizations who are taking their own steps in terms of protection of their congregations. Just yesterday, the Diocese of St. John's Bastia would have issued an advisory as it relates to the receiving of communion. Until such time, they would have done something similar with the outbreak of chikungunya. And essentially, for those of you who are Roman Catholic, and I suspect the Anglicans will do so shortly, you're only allowed to receive communion in your hand, not in the form of the host, not in terms of wine where you're sharing a cup and things like that, or that the priest puts it on your tongue. You have to take it in your hand. So if they're doing their own part, the rest of us need to do our own part as well. Of course, we've seen some of the jocular videos out where people doing foot shakes and knee knocks instead of shaking hands. It might seem jovial and lighthearted, but it has a serious under message. Thank you for your attention, and I'll be with